Welcome to the Wellness Dentist Podcast. Join biological and cosmetic dentist Dr. Katie Toe as she explores holistic wellness through trending ideas, real stories, and patient experiences. This podcast will inspire you to make healthy lifestyle choices and take charge of your dental wellness. And now your host, the Wellness Dentist, Dr. Katie Toe.
Welcome to the Wellness Dentist Podcast. I'm Dr. Katie Toe, and today we have a very special guest. Not only that I've been learning, reading his book, learning from his teaching for years, but I personally taking his teaching in our daily life, taking liposomal vitamin C, magnesium, and really helping our patient heal so much faster and better. And introduce to you Dr. Thomas Levy. Thank you so much for being here.
My pleasure.
Yes. And I know that you just finished your presentations at the IBDM and the full rooms, learning so much about healing protocols and how to optimize this for our patient. Because we know with just the procedure alone, it is not enough to get the person to heal and build bones and feel better. How did you start as a cardiologist? How do you connect with biological dentistry to begin with?
Fate and serendipity, I suppose. It was, a little over 30 years now, back in Colorado Springs in the early 1990s. I was, shall we say, a traditional cardiologist, reasonably satisfied with my profession, what I was doing, feeling like I was helping patients. But I gotta say, they have the old expression, when the student is ready, the teacher will appear. I actually spent some afternoons in my office when I didn't have patients saying, what you're doing is okay, but it's not what you want to do for the rest of your life. But I had no idea beyond that what that might mean. And within a few months of that, I met Dr. Huggins at something called an Extraordinary Science Conference, which is about Tesla and alternative forms of energy. We were, I guess, always a bit of mavericks in every part of our lives. And we struck up a friendship, and he said, come by the clinic sometime. And he had a massive clinic in Colorado Springs, and I think something like 55 or 60 employees. And he had patients coming in from around the world, and they'd come for a 2-week stay where they would get what we came to call a total dental revision, which all the things that are involved there, good counseling on diet, and an appropriate array of supplements. And I still remember he invited me to come over one afternoon, and I saw this little old lady, some neurological condition, in a wheelchair, and pretty decrepit looking, pretty unhealthy looking. And she was getting just hours of dental work. All right. And I poke in and out. And I noticed as the time went on, rather than look miserable, she was getting more and more and more animated, more and more. And by the time all the dental work was done, she was talking to her caregiver and saying, I want you to find me a good restaurant in Colorado Springs, and I'm going to eat a good steak on the other side of my mouth. And about that time, Hal walked into the operatory, and I said, Hal, I might have said Dr. Huggins at that time.
Mm-hmm.
And I said, what's going on here? And he pointed at the IV. I said, okay, I've seen lots of IVs in my day. Tell me what's in it. And he said, 50 grams of vitamin C, 50,000 milligrams of vitamin C. And I think, as the British like to say, I was gobsmacked. And I said, what? And of course, I was like every other layperson and many doctors still at this time that said, vitamin C, that's good for you, sure, blah, blah, blah. But I saw what was happening, and I saw something that certainly had never seen used as a therapeutic agent.
Mm-hmm.
Okay, yeah, vitamins are good for you, take a vitamin.
Mm-hmm.
And literally, and I think this comes from German, Augenblick, and like the blink of an eye, my life changed. Because I can't speak to how other people react, but when I see something and I witness it personally and it's overwhelming, my reflex is not to deny it, but to embrace it.
Yes, amen.
And
Mm-hmm.
so that, at that point in time, literally began my 4-year odyssey of researching several thousand articles on vitamin C and compiling all the information from my book, Vitamin C, Infectious Diseases and Toxins, Curing the Incurable. And shortly thereafter, Hal said, why don't you come work with me? And I mean, quite honestly, I dropped cardiology like a hot potato and began working with him, doing medical consultations and also doing follow-up consultations of people after they came out. And along the lines, I also saw how miserable so many people are, miserable at the way they act, and the continual stream of legal BS that Dr. Huggins was going through. He actually had on retainer a lawyer in Colorado Springs that he paid about $15,000 to just every month just to keep things going. And somewhere along the line, I said, this is BS, but what you going to do about it? And he was paying me well. I had a lot of time on my hands. And I just got this crazy inspiration to go to law school. And so I took the LSAT, got in the University of Denver School of Law, and did what I called a 90,000-mile, $90,000 program, because you're commuting to Denver for 3 years. And anyway, haven't really used the law license except for the fact that it's definitely changed the way I think about things, the way I approach things. And there are a few little potential board actions that I think were thwarted because of my legal background. And then since then, shortly thereafter, I became aware of and affiliated with Live On Labs and liposome encapsulated vitamin C. And that was amazing in and of itself, because I was a bit of the arrogant doctor that I hate now. All right.
Yeah.
And they say, hey, look, you got to try our product. And I said, oh, okay. Send me some. And I sort of got some and just tossed it in the closet. But I had closed at that time, my clinic in Colorado Springs, so I couldn't get IV vitamin C anymore on the blink of an eye, and I got the flu. And I felt horrible. And I'd already taken so much regular vitamin C, the diarrhea was nonstop. And I remembered one thing, and one thing only, because I didn't know anything about a liposome. They said it doesn't have a bowel effect. You get all those. I said, wow, okay, well, I could take more and not aggravate this further. And I took 5 packets, 5 grams. And in half an hour, 45 minutes, I felt better than I'd ever felt after a 50-gram IV. So I said, I think, Dr. Idiot, you need to research a liposome, figure out what's going on. And that was very significant, because that allowed the next basically 20 years of my life to be supported by Live On Labs and not have to have a clinical practice. I mean, I've written 14 books now. I don't think I could have written one if I'd had a 50-hour-a-week practice and then many hours in the hospital. You got to have time for that. You got to have energy for that.
That's
I mean,
right.
even if you could carve out 2 or 3 hours in the evening, your mind is down to a frazzle by the time you've gone through a day. So that brought me up to now, and it's just been a continuing, pretty exciting journey. COVID brought around a lot of misery, but it brought around a lot of realization as to how evil our medical structure is in so many ways. But it's also made a lot more people aware of things. So
Yes.
that's the real silver lining in COVID. Nothing can justify what they did or what was done. But now more people than ever know before that just picking the doctor out of the phone book or picking a dentist out of the phone book and going there and expecting that your best health and dental wishes are going to be taken care of, now realize not really, not likely.
Yeah.
And so that's where we stand today.
Do believe it's quite a journey, because your journey as a cardiologist, then you met Dr. Hal Huggins and you went to law school, then you work and research and wrote so many books and really bring the Live On Lab liposomal vitamin C to the biological dentist. And now we have a tool, because as a practicing dentist in the state of Texas, I cannot prescribe or giving my patient vitamin C in the chair, especially high dose. And so we really appreciate that tool, because we be able to support the patient. And of course, we work with the medical doctor to support them, but the accessibility
Mm-hmm.
and how that you don't have to worry about any issues with the needles and the
Expense
expenses. Yes, it is
or
a
extra
barrier,
personnel.
right? And so that is a huge win for the biological dentist. And you aware we actually build that in as our protocols and recommendations for our patient. Wow. I don't.
Ironically enough, and it is sort of ironic, but taking the proper amount of the live-on liposomal orally
Mhm.
gives you at least as good, and in many cases, a better clinical impact than the IV. Yeah. At one point in time, it never became official, but we sort of semi-marketed it as IV in a box.
Hive in the box, yeah. But I learned from my functional doctor who doing high dose vitamin C IV for patients that people don't know the source of the vitamin C, where it come from.
Mm,
They think all the IVs are the same, and we know that's not true.
sure.
Yeah. And so can you share with our listeners and audience, there's different type of vitamin C that it can get from, and why do you don't want just any vitamin C? You want a good source.
Well, vitamin C can be derived from different things,
Hmm.
beets,
Yes, right.
and corn,
Corn, yes.
and cassava,
Hmm.
okay. And it can also be synthesized,
Hmm.
all right? And that sometimes really puts people off, but let me tell you, if you synthesize something and you purify it, a vitamin C molecule is a vitamin C molecule is a vitamin C molecule. I mean, and the other thing is, now some people, claim they're sensitive to the source of where it comes from. Well, that has to do with two things. One, of course, is purification process. But I'll tell you this, uh, with the rarest of exceptions, I mean, like at the Reardon Clinic, where they've done 200,000 infusions over the last 35 years or so, um, they really haven't run across, to any significant degree, people having sensitivities. I'm not sure. I think there might be other things that some practitioners put in the IV, and then the vitamin C ends up getting the blame, okay?
Hmm.
However, be that as it may, even if you have a IV of vitamin C that uh, you might have some concerns, oh, it might have this contaminant, it might have that contaminant, or trace amounts of this toxin or that toxin, you got to remember, you've got a massive amount of the substance that's most ideal to deal with any toxin.
Hmm.
So there's really, unless you just have some sort of exquisite sensitivity that you're not sharing with everybody else, it's perfectly fine. And I got to add this too. I mean, I'm a great IV fan of vitamin C. And when I talk about liposomes and being in some cases comparatively better than IV, that doesn't mean I'm not for IV. I mean, as I like to say, if I get sick, I want both.
Hmm.
Because different forms of vitamin C go different areas, have access to different areas, and have different impact. So, IV vitamin C, you can get really high doses that can have a quick positive cancer or pathogen killing effect that you won't get as rapidly with liposomes, although you'll eventually get it with liposomes. And so there's all sort of considerations the clinician can go through, but it's good for a clinician, patient, to have both of them in their armamentarium.
Yeah. I know some patient would love to have a port and have vitamin C daily, but I can tell you the liposomal is so much easier when you travel.
Sure.
I do not travel without it because I know I can just make sure that my immune system is
No.
support. You're flying, you living you sleep in a hotel, you meet so many people, but that's a daily immune practice, right? You just help you to increase your immune system.
And another important thing, because there's so many people now, understandably, frustrated about vaccinations. I mean, I said in the lecture, and I'll say it again, I, in my personal scientific opinion evaluation, don't think there's a justification for any vaccine, any condition, any time, any person, any time in their life, because it introduces toxins that sometimes have catastrophic effects. And is, in my opinion, childhood vaccinations are the primary, overwhelming cause of autism. Forget all the rationalization they're trying to go through. But uh, the liposome vitamin C has offered anybody that's listening to this, a mother with little children, And sometimes, and this is really horrible, but it happens, parents are they're coerced into vaccinations. They're going to lose their jobs, or they're going to lose the insurance, any sort of a number of things. And even though they don't want to, they will. Well, it's so easy to protect again. Just as we've talked about with different dental procedures and protecting against them, a mother can get a single box of it, 30 packets. And the nice thing, too, is you can't overdose on it. So people, oh, a little child, what have I, 2 packets? No, no. And and if you even have an infant, okay, you squeeze half a packet and put it in a little milk or something like that. There are ways to do that, or in a little bit of yogurt. Point being is just getting the smaller, the less you need, obviously, but a little tiny baby, 1 packet a couple days before, the day of, before and after, and several days more, and you've got virtually absolute protection against a potential horrible side effect. And they got many. Most people don't even realize how many side effects there are to vaccinations, but you can protect all that. And if you're still a vaccine believer, again, guess what? It actually augments whatever immune response that the toxic antigen is supposed to induce. But it's nice and practical. I mean, people for, oh, I can't get an IV or this, don't need to get an IV. Just get this, and your baby or your little child's going to do fine.
Yeah.
And it goes for the adults too. Some adult that
Yes.
I
No,
mean,
they would pass out when they see needle.
yeah.
Both of my children, one turned 10 this summer and one just turned 4, and they've been taking liposomal vitamin C since they're little, and everyone's shocked how easy. They just tear the package and then take it. And people are like, wow, how do they take it? Because it does have some taste to it. But I'm like, you just use that.
I
If that's
started
become your
my
routine.
little girl on it. She was
Yeah.
like about 1.5 or 2.
Yeah.
And she would see me, the little tiny packet of yogurt they have in Colombia, South America, and I would squeeze the packet in, and
Mix
she'd
it.
eat. And then it got to the point there where I'd bring out the yogurt, and I might not think to put the packet in, and she'd, oh.
Yeah. You're missing.
You're missing.
Yeah.
Put the vitamin C in. So.
Yes. You last year, at the last year conference, you introduced a book about magnesium, and your talk had so many dentists was like, oh my goodness, I will focus on vitamin C, but I forgot about the magnesium. And there's so many confusions about magnesiums out there because there's so many types. In your book, you list all the types there. And I recommend you get the book. Like if you think you listen to the podcast and you get all the knowledge, no, get the book, go order the book, read the book. It's a great book, by the way. And so can you share with us a couple of things that people think they know about magnesium, but they don't?
Well, I'm going to start out by shocking people a little bit.
Yes, please do.
And say magnesium, if you had to pick one supplement, and obviously you don't want to pick just one supplement, but for the sake of argument, if you had to pick one supplement, you take magnesium over vitamin C. Because vitamin C is a powerful antioxidant, and there are many other good antioxidants out there that could support what vitamin C you have. So not to replace it, but support it. So you don't go absolutely devoid of good antioxidant activity if you don't supplement vitamin C. Magnesium, however, number one, everybody is severely deficient in magnesium for a number of reasons, usually the extensive toxin exposure that we have. But number two, nothing compensates for magnesium except magnesium. And magnesium deficiency is at the root and cause of many diseases, and a primary aggravator of all diseases. And in a nutshell, it's because elevated calcium levels inside your cell are always the causative and reflective reason for oxidative stress inside your cell, which we said is all disease, oxidative stress. And the only thing that brings that calcium down is magnesium. So the magnesium comes in, the calcium goes out, the oxidative stress comes in, then more vitamin C can go in, and everything's hunky-dory. But magnesium is so powerful, and it's also a primary anti-calcification agent. People are always worrying about kidney stones, calcifying their arteries. All of that is part of it. vitamin C, magnesium, vitamin D,
Mm-hmm.
and vitamin K uh, are probably your four most important supplements. Okay,
Daily,
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 and
yes.
certainly for sure. I
Mm-hmm.
like to tell people poor, they can't afford. You give them a list of 15 supplements, they get frustrated. They don't take any. Well, no. Make sure you take vitamin C, magnesium, and vitamin D.
Mm-hmm.
Everybody's deficient in those at the baseline, and each one separately will increase all-cause mortality, your chance of death from everything, if you're low on it. And you can eliminate that by proper supplementation. So let me add more things about magnesium.
Yes.
Is magnesium, low magnesium is the primary reason for all the different vasoconstrictive disorders like a migraine, seizures from migraine. It's also the primary cause of neurons that get excited and precipitate a seizure, and in the same fashion, cardiac cells that get excited and precipitate arrhythmias. Something I go through in the latest book about magnesium, I don't think it was in the first book, is a heart cell cannot generate an extra beat if the magnesium level is normal inside the cell. So it's always atrial fibrillation, this epidemic atrial fibrillation, that's all magnesium, severe magnesium deficiency.
Mm-hmm.
Yeah, I mean, you can give magnesium IV push and terminate atrial fibrillation just like that.
Amazing.
Okay,
Mm-hmm. Yeah.
So very important because it's a very common condition, has a high morbidity and mortality, and is so easily addressed. But people have to be vigorous because it's very difficult to completely restore your magnesium, but you need to get it as high as possible.
And not all magnesiums are the same. That's the confusion right now. People thinking they just go to a drugstore and grab a magnesium supplement and this work. So right now, I know that we're taking the vitamin C liposomal from Levon Lab. We're also taking the magnesium L-threonate from Levon Lab. Why magnesium L-threonate?
Well, magnesium threonate is, I'm not an expert on the literature on it, but it's supposed to be established in the literature as having better increased uptake in the brain.
I see.
And of course, you want magnesium everywhere in your body, but the brain is a good spot to get at an especially high level because, once again, oxidative stress rules. And a lot of people can tolerate a little more oxidative stress in organs other than their brain more effectively. So, but it's important to emphasize, too, as far as magnesium supplementation goes, people say, well, what type of magnesium should I take? Because you have many different forms.
That's right.
Well, you need to remember there's a cation, the positive part, that's magnesium, and an anion, that's the negative part, that's citrate, glycinate, whatever. And that makes them all different. I mean, the anion is a supplement in and of itself. Taking a lot of glycinate, magnesium chloride. Chloride is very anti-pathogen. Citrate, that's what they clean you out for a colonoscopy. And lots of different forms of magnesium. So some are absorbed a lot better than others. But the bottom line is, even the cheapest forms of magnesium supplementation, like magnesium oxalate, is still good for you and will still get magnesium in your system. So don't be put off by the fact that maybe you can't afford the most expensive magnesium supplement. Still take it on a regular basis. You'll be doing your body and your health a favor.
I love that message because most people are thinking, oh, I have to buy the most expensive, I have to buy this type. But the general message is like everyone are depleted or deficient.
That's right.
Like vitamin D3, K2, and like people are just like, oh, what form do I take? Like, take some because your body needs that. And so I love that message because people get to zoom in on what and when's and the dosage and forget that, the consistency, the compound effect day after day that count.
Right.
Because people, again, come to see biological dentists, they think that if they're taking that infected tooth out, then miracle is going to happen. No, you need the support. You need the vitamin C, the magnesium, the vitamin D3, K2. That's just the basic to cover. So I love that reminder a lot. And so you're talking about this and you traveling extensively. You're doing a lot of conferences and lots of speaking engagement, and you have so much energy. So my question for you is, everyone curious, what is your 3 daily non-negotiable in terms of wellness practices for you?
Well, a good night's sleep. All right.
Yes.
And that wasn't always easy, but one thing helped the other. As I made certain changes in my life, certain in my supplementation, then the sleep started getting better, and the better sleep came back and reinforced things.
Mhm.
So excellent, good sleep, proper supplementation, the interactions on a daily basis with a loving family and a handful of friends. And I gotta throw a little bombshell on you here too.
Okay.
And this has been for the past 5 or 6 months. I got very tired of having my little belly,
Mm.
and without really paying attention to everything they're saying about maybe side effects, I started on the GLP-1. Okay?
Oh, okay.
And magic happened. I started losing symptoms that I'd had all my life. And after the fact, I said, I think it's about time you did, as they like to say, a deep dive
Mhm.
on GLP-1. And fortunately in Colombia, it's cheap, it's over the counter, so
Mhm.
it's oral, no injections.
Mhm.
And lo and behold, I found out, without having to go into a lot of detail, that the primary function of GLP-1 is to set the stage to allow more vitamin C to be pulled into the cell.
Wow. Am I the first one to hear this on podcast right now?
Probably so. Yes, indeed. Yes, indeed.
Yes.
And I wrote a paper on it. I did the research.
Mhm.
First of all, by itself, it decreases all-cause mortality. And that's about the most important study you could have.
Mhm.
But then and all the effects of it, all paralleled effects of more vitamin C. And it was so clear-cut, I terminated the paper with my suggestion, and it remains, and for me, it's been one of the single most supplemental phenomenon that I've encountered. I recommend everybody take a low dose of this along with their vitamin C, because most people, whether even if they don't consider themselves overweight, can lose a few pounds. Everybody,
Yeah.
very
I
exceptional.
think we're in denial. There's, we
Exactly.
look at everyone BMI, and we have
Exactly.
American standard and international standard, and our standards are way so much
And-
higher.
And the only reason not to take it is, like for my wife example, she takes one and she gets diarrhea. So, I mean, you just have some people that are sensitive. So, but most people, no problem. All right.
Mhm.
And if it's no problem, take it like another supplement. Now, it's still a little difficult in the States. The TrumpRx.gov has brought the price from $1,200 down to $150 for a month's worth of oral. So it's no longer a financial limitation. You still need your prescription. So you need a doctor that appreciates all this. And I wrote it all up on my website, tomlevymd.com. You'll see the article, because it's completely changed my life. I'm 75 now, okay? And without being too disclosing, I was up to where I had 5 times a night had to get up to urinate.
Mm.
Now it's once.
Wow.
I mean, everything in your body changed. I mean, I talk about all the time in my presentations, and I stick by it.
Mhm.
The most important thing for your health everywhere in your body is to increase or normalize vitamin C levels inside the cell. And that's exactly what this does.
Wow. It's a combination.
Uh-huh.
That's the magic, is like the sequence and the right combination.
Right.
Because by itself, it's not as powerful, but you put a GLP-1.
And taking the large amount of vitamin C also completely eliminates the possibility of the occasional horrible side effects that they like to scare people with
Mhm.
in the popular press.
Yeah. People don't talk about it, but when I see patients in my chairs, a lot of people are taking GLP-1 and they see the benefit. That's why they're on it, but they forgot about the vitamin C.
Right, that's very
So
important.
that's a great reminder there. Thank you so much. My God, I want to keep you on this show because I learned so much, and I'm sure our audience and listener love listening about this, and it's such an honor. Thank you so much, Dr. Levy. And of course, I see you at next year conference, and you keep writing books. We love your books, and we love your energy. And thank you, everyone. And please follow Dr. Levy, ThomasLevyMD.com is your website.
No, Tom Levy,
Tom
MD,
Levy, MD.
TomLevyMD.com.
Yes. We put that on a show note, so please check the website and get in touch and keep learning. Thank you so much.
Thank you very
yes.
much.
Bye.